All right, so we're diving deep today into all the buzz around EGCG and diabetes.
Sounds good.
And for those who need a quick reminder, EGCG is that powerful compound found mostly in green tea.
Right.
That's gotten a lot of attention for its potential health benefit.
Exactly, and we'll try to sort through all of that.
Yeah, we're going to try to make sense of it all, break down the science, and figure out what it really means for folks who are dealing with diabetes.
And how they might want to think about incorporating it or not.
Yeah, exactly.
Yeah.
So we've got a lot of research laid out here, a lot of different studies and perspectives to dig into.
I think this is a really important topic, and
We want to make sure we give you guys the full picture.
especially because managing diabetes well, it involves so many different aspects.
Absolutely.
Yeah.
So let's jump right in. One of the most talked about benefits of EGCG is its potential impact on insulin sensitivity.
Right. And I think that's where a lot of the excitement comes from.
Yeah, so, for people with type 2 diabetes, their body doesn't use insulin as efficiently as it should.
Leading to higher blood sugar levels.
Exactly. And what's interesting is that some research suggests that EGCG might actually help improve that sensitivity.
And there are a few potential mechanisms at play here.
Yeah.
One idea is that it could enhance the signaling pathways of insulin receptors.
Making the cells more responsive to the hormone?
Exactly, which is huge for blood glucose control.
Absolutely.
Yeah.
So it's not just about how much insulin your body makes, but also how well your cells are actually using it.
Right, it's about that whole communication process.
And that's where EGCG seems to come in, potentially.
Now, on top of that, EGCG might also affect blood sugar directly.
Oh, really?
Yeah, some studies suggest that it could inhibit certain enzymes involved in digesting carbohydrates.
Like blocking them from doing their job.
Exactly, and one of those enzymes is alpha-glucosidase.
Okay.
And by inhibiting these enzymes, EGCG could lead to a slower or a less dramatic rise in blood sugar levels after meals.
Which, that's like the holy grail for a lot of people managing diabetes, right?
It really is.
Keeping those blood sugar spikes in check.
And I think what's so appealing is that this could be a more natural way to potentially achieve that.
Yeah, and it ties in nicely with the whole idea of using lifestyle approaches alongside medication.
Absolutely. Now, we also can't forget about inflammation.
Right. Inflammation is a big deal in diabetes.
It's a huge factor in the development of complications.
Yeah, and EGCG, it's an anti-inflammatory.
Yes, it is.
So it might offer some protection there.
Right. So it's not just about managing blood sugar in the moment, but also about preventing those long-term issues.
And another thing that came up in the research is oxidative stress.
Oh, yeah. Oxidative stress plays a role in damaging those pancreatic cells that produce insulin.
So the very cells that are crucial for regulating blood sugar.
Right. And since EGCG is an antioxidant, it could potentially protect those cells.
That's a big deal.
It is. It's about supporting long-term insulin production.
Okay, so we've got potential benefits for insulin sensitivity, blood sugar control, inflammation, oxidative stress.
And we can't forget about weight management.
Oh, right, because weight is so closely tied to type 2 diabetes.
And there's some evidence to suggest that EGCG might help with weight loss, or at least maintenance.
Which would have a ripple effect on overall metabolic health.
Exactly.
So these are all really interesting possibilities, but what about the actual clinical trials?
That's the key, right? We need to look at the data.
What does the research actually show?
Well, there have been a number of clinical trials looking at green tea extracts, which are naturally high in EGCG. And some of these studies have shown reductions in fasting blood glucose levels and HbA1c levels.
Okay, for those who aren't familiar, HbA1c, that's a measure of your average blood sugar over the past 2 to 3 months.
Right. It gives you a bigger picture of blood sugar control.
So these findings are definitely encouraging, but
But we always have to remember that results can vary.
yeah, everyone's different.
Right. It's not a one-size-fits-all situation.
And in many of these trials, the dosages used were in the range of 300 to 800 milligrams of EGCG per day.
Yeah, so if you're thinking about supplementation,
Talk to your doctor first.
absolutely crucial.
Because, like we were just saying, individual responses can vary so much.
And there are other considerations too.
Right, like what?
Well, existing health conditions, medications you're taking, all these things can influence how your body reacts to EGCG.
Okay, so even though it's natural doesn't mean it's a free pass.
Exactly. You still need to be mindful.
And there's also the issue of potential side effects.
Right.
While generally safe at moderate doses, high doses of EGCG have been linked to gastrointestinal issues.
Some people experience nausea or upset stomach.
And there have even been rare cases of liver problems.
So professional monitoring is really important.
So let's bring it all together. What's the main takeaway here?
I'd say EGCG shows promise as a complementary approach to diabetes management.
especially for type 2,
Right. The research is still ongoing, but it's a fascinating area.
but not a replacement for conventional care.
Absolutely. Lifestyle changes,
Big deal.
medication, those are still the cornerstones.
So as you consider all of this, the potential benefits, the things to watch out for, what stands out to you about incorporating new health information into your routine?
It's a good question.
Thanks for joining us on this deep dive into EGCG and diabetes. Always talk to your doctor before making any changes to your health regimen.
Definitely. And continue to research and stay informed about your health.
We'll see you next time.
See you then.